Thank you, Dr. Boral, for giving me this opportunity. Well, I will be sharing few of my longest days in OR, or few of them were nightmares too. So, without much delay, we'll start the videos. So these are the 4 cases which I'm going to show: dislocated IOL, spontaneous retinotomies, lost flap, difficult macular hole. To start with the first one, this was a simple case of a dropped IOL. As we can see, the one of the haptic being stuck. So doing the vitrectomy and getting it disengaged and clearing the vitreous around the IOL. Then with the cutter itself, we are hanging the IOL and then taking out the IOL. Making the main port. And then try to retrieve the IOL. Till this phase, everything was fine. And then something happened. The IOL was stuck somewhere. And then I realized that the haptic got badly stuck to the iris, and the iris, from the iris, the profuse bleeding started, both anteriorly and posteriorly. As you can see in the video, there's a profuse bleeding underneath as well. There was a loss of glow, and the bleeding was very difficult to control, and iris was badly stuck by the haptic. Haptic was stuck in the iris. So tried to put some visco, control the anterior segment bleeding, and trying to manipulate the IOL so that the stuck haptic gets dislodged. And by flipping it from the other side, we could manage to disengage. But this was a quite long process, not like what has been showed in the video. So there was a lot of adrenaline flow that time. Well, you can see the posterior segment is full of blood, clearing the blood. After clearing the blood, we put an iris claw, because by that time there was no iris bleeding and iris was quite healthy. So we put the iris claw. So the simple case, there was definitely a code red situation which we managed, and the patient got sick.